Hello everyone, Lux Fink here. Today we'll talk about estrogen management on testosterone replacement therapy. Quick disclaimer, there's not medical advice, this is entertainment only. So a lot of patients who are on testosterone replacement therapy believe that estrogen is our great enemy as a man. So as you know, testosterone will or can convert into estrogen via aromatase, and elevated estrogen levels can cause to several side effects such as breast tenderness, tissue buildup like gynecomastia, puffy face, etc. And that's why a lot of patients believe that they have to take an aromatase inhibitor or AI to basically crush their estrogen levels to the bottom and be near zero. However, estrogen has some very important functions in our body. It helps with bone health, brain health, cardiovascular function. It helps with libido. It helps with erectile function and mood. So crushing your estrogen is not the way to go. The way to go is to have a healthy level, not too high, not too low. So usually when somebody is on TRT, the dosage would be somewhat between 100 and 200 milligrams of testosterone per week, and the portion of testosterone converting into estrogen via aromatase shouldn't be that dramatically high as those levels seen in bodybuilders who take extremely high amounts of testosterone and much more converts into estrogen, and then the side effects really become harsh. Okay, and we're talking about really high dosages of testosterone that is exogenously introduced into the body, and hence there will be more aromatization and more estrogen levels. But for a traditional testosterone replacement therapy, the risk of going high in estrogen are not as high. And if you think you have symptoms of high estrogen, then taking an AI, an aromatase inhibitor, could be a solution. But I would try first to try different methods to manage estrogen in the natural ways. So first is change the drug or the testosterone medication. So it is known that if you take injectables, for example, like long-acting esters like cypionate and enanthate, then after injection, testosterone goes very high for a couple of days, and this can lead to elevated estrogen levels, since the level of testosterone is also elevated for a couple of days. So if you change to a shorter ester, like in an oral pill, or let's say a cream or a nasal spray, this could also help with reducing the amount of estrogen, since the testosterone levels will be more stable. Uh, Injection intervals, if you have to inject, sometimes due to health insurance constraints, people have to stick with an injectable testosterone, and instead of injecting once per week or once every 2 weeks, injecting twice or 3 times per week might also improve the conversion rate of testosterone into estrogen. And lastly, fat reduction, since the aromatase enzyme is mainly found in fatty tissue. Reducing body weight, especially body fat, can also help with reducing the enzyme that converts testosterone into estrogen. Okay, so those are natural ways to manage your estrogen levels on TRT if you seem to be slightly high, if you run a little high in estrogen, and if, of course, you run way too high on estrogen, or if you're taking extremely high doses of testosterone, you might need to take a aromatase inhibitor, and this will take care of the excess estrogen levels. However, even if you take an aromatase inhibitor, you should always make sure that you take your blood levels to see where you're at with your estrogen, and make sure you don't crush your estrogen to levels that are too low. Again, too little estrogen in your body can have several side effects: joint pain, low libido, mood swings, it is a variety of side effects you do not want. Okay, so I hope this video was helpful, and please let me know what you think in the comments down below. Thank you for watching.